Perfect. So good evening, everyone. I'm sure you've heard that this session is being recorded. I think everyone here knows me, but for those who don't know me, I'm Amit Patel, Chief Executive of Community Pharmacy South West London, and really glad to have you all here. As of a couple of weeks ago, before the extension was announced by Community Pharmacy England, there were 99 contractors in South West London who hadn't submitted their CPAF questionnaire. I'm going to hand over to David in a moment. I'm really thankful for having him here, and he will introduce himself and share his expertise. And thank you, Hina, for supporting the session and transcribing. What we really want to do tonight is discuss what you need to consider whilst filling in your CPAF questionnaire, why it's important, and why it's important to engage with the program of CPAF and not just look at it as a tick box exercise. What benefit it does, not just for you, but for our sector and for our patients. So without further ado, I'm not going to bore you with droning on and making you hear my voice any longer. I'm going to hand this over to David because it's his session. David, please introduce yourself and thank you for doing this for us.
Thank you very much, Amit. And Hina, if we could have the next slide, please. Thanks. So I'd just like to, first of all, thanks James Wood and Katrina at Community Pharmacy England. They actually reviewed this slide deck. I used to do work in London region. I headed up pharmacy assurance. So I was the guy at the other end with the clipboard coming out to pharmacies and leading on this process. And one thing we did in London is work very close with our LPCs to get good high returns. And Amit, Baron, correct me if I'm wrong, South West London normally had a very high return over about 98%. So right. This is something we want to carry on and make sure we do. Next slide, please, Hina. So that's our agenda for today. And one thing I'll say is this presentation is peppered with links to make sure everything's in one place. So it's for your convenience as well. And I tend to put in more information than is required, but it's a takeaway information that we'll send this to you tomorrow. So then you can have everything in one place and then click the links and then find information to help you with CPAF. Next slide, please. Okay, so just very quickly, one back, please. Oh, very keen, Hina. Oh, wow. So think of CPAF not as a tick box exercise, not as a one-off. It's an annual program. Okay, it's oh, gone. I can't keep up with you. Oh, steady on there, Hina. So we've got two parts to it. First of all is the screenings questions, which we're in right now. That's from the 1st of July to the 31st, 10 questions, okay? Now, Amit, there may be visits after this. Now, the dates I've put in for CPAF screening and full CPAF, we're not sure what's going to be happening next. I checked with Community Pharmacy England. But in the past, the CPAF screening visits used to take place between September and October. It's for the London team to confirm, okay? Now, if pharmacies don't fill in their CPAF or their other issues, they're invited to do the full CPAF questionnaire. That's the big one. And one of the tips I'm going to give you is read that one as well. Okay, understand the full context. If you get selected to do that, that's a big questionnaire. That's everything. Okay. And the visits that follow that, so if there's still things that are not right or they want to visit you again, that's going to be a full detailed visit. Okay. And that's where you don't want to be in that position because you want to make sure you pass your CPAF because this is an assurance tool. If you're not assured with your assurance framework, that means you can't do advanced services. That's part of your terms of service, okay? Right, oh, has the presentation disappeared? Oops, sorry for that break there.
Maybe having some technical difficulty.
Let me just see if I can.
Yes, David, I think it might be better if you share just now.
Okay, right. Can you see my screen, everyone?
Can you put it in presentation mode?
Yeah, presentation. Right, let's start again. There's the moving people. Okay, so all we need to say is first takeaway point: look at the full CPAF questionnaire and look at the screening questions. Okay, it's one process. The screening is a light touch. It's 10 questions, okay? But then look at the bigger context. And if there are any technical issues, you've got the email details for the NHS BSA and the link to the Community Pharmacy England website where they've got everything on CPAF, okay? So the portal opened on the 1st of July through MYS. The questions have to be filled online. Now, if any of you have not received your invitation email from the BSA, email them. And not to be too pedantic, copy in the LPC as well. I'm more than happy to copy in myself, just in case for some reason you've been left out with all these changes of ownership going on and changes in pharmacies. Sometimes some pharmacies get left out. So if you're not sure, just email the BSA if you've not had the email, and then copy us in so that we can just make sure that you do get it. Okay. Right. I shall go on to the next screen. Right. Okay. So CPAF, each questions are there roughly 3 sub-questions per question, okay? And they're interdependent. So basically, if you want to hit level 1 in each of the questions is the basic level of attainment. Level 2 is intermediate. Level 3 is exemplar high-level practice. We'd love, I think Amit would agree with me, to see all of you guys hitting level 3. But what you're going to bear in mind is that you've got to tick every single question. So if you're on level 1 and you tick only one of the questions, then you haven't ticked anything, you haven't declared anything. Okay. If you want to hit level 2, you must do all of level 1 and all of level 2. If you want to attain level 3, you must do level 1, level 2, and level 3. If you tick level 1 and level 3 and leave out level 2, you've only declared for level 1. They are interdependent. Okay. So take your time, go through these questions. Now, Amit, this is something you can feed back to the powers that be. When you get your forms, okay, you can download them from the BSA website. It looks like 16 questions, but actually 6 have been retired. And I do wish that I actually managed them out. But there are 10 actual questions: storage of prescribed medicines, repeat dispensing, prescription-based interventions, signposting, clinical governance, safeguarding, promotion of healthy lifestyles, premises and privacy, pharmacy staffing, and opening hours. Those are the 10 questions you have to follow. Okay. Very quickly, SOPs. I mean, at the moment, this is only the screening, so you're not being visited, but basically, NHS England, or rather the London team, have no right to go analyze and check your SOPs. All they should be doing is checking that they're up to date, they've been signed by the relevant people. And another tip I could feed back to you based on the visits I've done is keep a log of who's signed your SOPs, cancel out those people who have left, but make sure you put down the staffing, the role of what the person does. Are they a frontline member of staff? Are they a technician? Are they a dispenser? And then which relevant SOP are they signing off? So keep a log so you can show definitely to anybody who visits your pharmacy that the information is there, and make sure your SOPs are up to date. So if they're coming up to expire in the next few months, start redoing them again. And the other tip I'll tell you is through this process, if you see any gaps that are not in place, fix it. Don't wait to be invited for a visit. Okay. And in terms of recording advice and intervention, now this is where we've got to think of it smart, because actually, if you look at this, you have to record advice and intervention where clinically appropriate or where it's deemed significant. You can't record everything. You'll go mad if you do that. So this applies to dispensing, repeat dispensing, public health, signposting, and self-care. So these are several questions, separate questions in this CPAF screening, and yet they're linked up by standard recording of advice and interventions. Now, we emailed out a Word document today, Hina and myself, where I extracted the relevant information on recording advice from the Community Pharmacy England website, and it goes through each of those sections for repeat dispensing, public health. And Hina and I will send it again, all the information tomorrow, so you have it in one place. So look at that Word document I sent you, okay? Because that will tell you how to record advice. And what we want to see is, that you're sort of recording clinically significant information, you're acting on it, you may be reviewing it as well. If you think may have gone wrong, or patient could possibly complain, or something you need to raise formally to another clinician, keep a record of what you're doing. Make sure that your team know if any locums are coming in, make it clear if anything happens, record a significant event, but make sure they inform the whole team. Okay, but this is about thinking smart, because actually recording advice and intervention covers several aspects of the contractual framework, the screening questionnaire. Another terminology is NHS approved particulars, which is a fancy title for anything clinical governance related. And there's several underpinning documents covering temporary suspensions, displaying notices, information governance, practice leaflets, premises, and recent updated on incident reporting, which I just covered earlier. Now, these are documents which are sort of only a few sides each. They're easy to read, but they give you a bit more background information. So a good example is the practice leaflet. There's information on the Community Pharmacy England website, but also from NHS England. It tells you the key information you should have in your practice leaflet. Okay, so when you are if you do have a visit, then it'll be a good idea to actually sort of have those documents to hand to show that you do understand this and that what their actual requirements are. Okay, so if a pharmacist says yes, there's an approved particular, so for practice information, practice leaflets, this is the information I should have, and my practice leaflet shows this, that it shows that you're getting on top of these things. What I've done for you is I've collated everything in one place, so it's easy for you to then find that and go through it. Okay. Incident reporting, I've covered that already. There is a requirement if there is an incident that you report it through. For the corporates and the medium-sized pharmacies, you may have your own internal reporting procedures. But what we need to see, and God forbid, if something does go wrong, that you go through the correct steps. You obviously have, you let any relevant clinicians or GPs know if anything has actually happened. Obviously, you reach out to the patients if they've been affected in any way. You show duty of care, but also it's the analysis, the root cause analysis, it's the review. And something we've done in visits is, show us your incident log, give us an example of the kind of incidents you've done. What have been your learning? What have you improved as a result of this? And some of the best practice I've seen is actually it's the pharmacy technician or the dispenser that acts as the clinical governance champion that collates all these incidents and sort of works with the team, the pharmacist and the rest of the team. So appointing a clinical governance champion is one tip I learned from several of the visits I did. Okay, so we're going to come to the actual questions now. If Amit or Hina, just keep an eye on any questions in the chat because I can't see that because I'm actually presenting. But I'm hoping for the first question, this is the bread and butter stuff, all of you at level 3. And this is straightforward. This is about dispensing, medicines and return of unwanted medicines. And when I was doing visits back in the day, a lot of contractors across London did not know who their waste arrangements are. So for South London, the contracting waste provider is Essentia. They are the waste managing agent that manages all the waste collection from your pharmacies through the various companies. Okay, and we've sent out today an FAQ that we set up last year to explain what you're meant to do. Okay, so again, it's about information being made available in the pharmacy. You may give information verbally, needs to reinforce about returning unwanted medicine. So again, this is something you can go back on your staff. Your medicines bags may have it printed information on there. And sometimes you print information supplying to patients for high-risk medicine. So some of your PMRs actually do that as well. So this is really, really basic stuff that hopefully all of you should be on level 3. Okay. Were there any questions? No. Okay. I shall go on to the next slide. Yep, there we go. So the next one is repeat dispensing. And hopefully now it should be electronic repeat dispensing. And the key things it's just making sure not yourself as a pharmacist, but also your frontline members of your team, your pharmacists, your technicians, your dispensers, and any other members of your team involved in dispensing understand. And sometimes when we've done visits, we find that some of the sort of pharmacy staff can't quite understand the difference between repeat dispensing and repeat ordering. So what is important is to make sure that the relevant members of staff have been trained and they got their CPP certificates to hand and they're up to date. If you are going through the repeat dispensing process, and apologies if I'm insulting people's intelligence today, making sure that any patients are made aware of the process, the reasons for not supplying a medicine and how it's recorded, and the reasons for not providing supply and providing feedback to the prescriber or the patient. Okay, so this is a well-established standard process, which hopefully there shouldn't be too many issues there, but go back and check, are you up to date on your sort of certificates? Are you up to date on the usage? And I'm assuming this is now high uptake in London, but there may be some parts of London where it may be a bit lower, but it's important you demonstrate you've got the systems in place and you are able to offer the service. Okay, so here's just some other questions that may come about repeat dispensing. And just make sure you understand about batch prescriptions. Conscious that repeat dispensing varies across London, but hopefully be at a high level as well. And also the key thing is that your teams, and this is a good test for you, go back to your pharmacies and make sure your teams understand what the steps are involved in repeat dispensing. So make sure all your staff involved in the dispensing process understands the importance of repeat dispensing, the benefits of repeat dispensing, because this is something you want to promote for your patients and your GP practices. Okay. Okay, and then we go on to the next question, which is prescription-based interventions. Now, this begins to overlap. You see, it's about working smart with health promotion, which is a question further down the line, because I was comparing the two, and there seems to be some overlaps between the two. But this highlights the public health role and interventional role of community pharmacy. So somebody walks in with a prescription for diabetes, coronary heart disease, it's giving people additional advice about, blood pressure, smoking cessation. And again, in most pharmacies, make sure you've got some leaflets in your pharmacy that have been ordered, or show the advice you'd give to a patient who comes in. Again, perhaps show an example of how advice, sort of that you recorded for a patient who may have CVD or coronary heart disease or diabetes. Also looking at the opportunity to give advice to carers where appropriate and to various patient groups. And when you take a note, so we talked about recording information. So if you look at level 2, the second part, it's recorded in a way that you can actually audit it and then do a follow-up on that as well. And then when you come to level 3, that's good practices. You're building in your clinical practice. You're recording the interventions and the advice given, and then you use that to then follow up with those patients. Okay.
I have a question from Lubna.
Yes, Lubna, far away. Dive in.
I was just going to say that this question seems like more generic to me, and in comparison to question number 11, which is healthy living pharmacy, because for that you need to definitely have specific arrangements in place, having some health champion and recorded data for this. Anyone like in the pharmacy, trainer pharmacists and technicians, they can do this prescription based interventions.
Right. So would you say this overlaps with the healthy living question?
Could overlap in a way. Yeah, could overlap.
Yeah.
Yeah.
I mean, this tells me that people are on top of this as well. Basically, this is about the dispensing process, but also once a prescription comes in, it's the interventional public health advice you then give from that.
Yeah.
And there again, now, work smart on this. There's information in here about recording interventions, then building advice on that. I've already covered that already. So you can see how these link in and actually overlap as well. And the other thing, just to factor in, some of the pharmacies I've been into where they're really on top of this, they've actually put in like a public health display board or an information stand where I said, look, here's the information we provide patients. We have regular bulletins, or we have regular health promotion campaigns. This is something they're doing as well. So that is sort of, I expect, as we start to renegotiate our contracts to local authorities, this is something we really need to work on and highlight to our local authorities that even in the core contract, there are things that community pharmacy can offer. Okay. At the same time, I'm going to caveat myself by saying, tick the levels you're comfortable with. Okay. And the other thing I'll say to you, which I'll summarize at the end, is keep a record of what you filled in. Because once you filled it in, go back to it and think, right, for next year, how do I get up to the next level? Let's say you're hitting level 2 on this. How do I get up to level 3? Again, that's when you reach out to your friendly LPC for advice and help.
Okay, does that to add? Lubna, you raised a really, really interesting point, and there's a couple of things here. One, healthy living is very, very focused on prevention, and this is ensuring that those interventions are at every stage of the long-term condition cycle. So it's not just about prevention and the public health approach, but utilizing the opportunities to talk about long-term conditions and health as a whole. And then the second part of this is actually how we can then link into having the evidence to create additional services that sit around our dispensing function. So when we talk about MEC interventions and the sort of work that we've done, it's very, very important that if we're doing this, that Community Pharmacy England are able to also capture this and have access to this to show that the value we're delivering. So you're right, they do cross over, but they cross over across the whole lifespan of intervention for the people that we serve, not just prevention and long-term conditions, but bring it together over the two. And it gives us very, very important data over both. So this is where, again, as we were saying before, around not just utilizing this as a tick box, but actually sharing the evidence and looking at level 2 and level 3 and pushing towards achieving gives us the ability to show how clinical pharmacy really is and the level of intervention that we can make.
And also just remember that it's not just you as the pharmacist, it's also your frontline members of your team, your technicians, your dispensers, and your frontline members of staff that can provide levels of advice. And that could be sort of, documented as well. So what we're doing here is, as Ahmed has said, we're trying to now box smart and prevent a really sophisticated sales pitch back to local authorities and the ICS to say, look, community pharmacy is clinical, but the key thing, the feedback from Ahmed and me is we want you guys at level 3, if not now, over the next year. So that really help us develop your skills much more, particularly for making every contact count. Okay, I shall go on to the next one, signposting. Okay, and this is something that there's been lots of questions in the past about, and I'm sure some of our pharmacies have been around the game may remember the old Primary Care Trust signposting folders that were provided a long time ago by the PCTs. Now the problem with those were it took a lot of time to do, and actually once they were printed off, how do you keep it updated? So the key thing is, and I know the system's in a bit of flux at the moment, but basically go to proven sources information. So the NHS website to find services, NHS England, South West London ICS, and local authority websites as well. So if you do get a visit, you can say, this is where I get my signposting from, and you show it online. And so that could be one way of getting signposting information. And look again, level 2, making a note, recording. What did Amit just say in the previous one? To help facilitate the audit and provision and follow-up care. Level 3, written referral. We tell customers about local services, using additional information, leaflets. That now is a bit of an overlap with health promotion and healthy living pharmacies. Okay, so we're seeing a bit of a blurring, but don't treat this individually. These link up and join up, and if you work smart on this, it's actually a very effective product as well. But you know what, guys, I like you people, I like you all. So this is not an exhaustive list, but what I did was I've added the links to South West London ICS, and within the website of South West London are the various places. Those are the boroughs. And also South West London ICS, where you can find local services. You've got the links to each of the 6 local authorities in South West London. Now, those, if you click that link, it should take you to somewhere where it shows local services as well. Do let me know if I've missed out anything or whatever. I'm happy to update this, but I've tried to put some of the national sites as well. There's the NHS website. There's also Asthma and Lung UK, Diabetes UK, Epilepsy. I'm sure there are others we could have, and there may be some on the Community Pharmacy England website. This is not an exhaustive list. I'm sure there are others, but I thought I'd get the core ones there. Your ICS and your local authority and a few national ones as well. So that's just to help you. Okay, clinical governance. If you did the full CPAF questionnaire, this section is as big as the first, about the other 2-3 sections. It's quite a weighty one, but here you've got 3 questions. So first of all, level 1, all of the staff know about the responsibilities for incident reporting investigation. We talked about incidents and root cause analysis and the importance of having, say, maybe a clinical governance champion in your team. And actually, a good example of pharmacists are, if they made a mistake, they showed how they reviewed it, how they brought their team in, but more importantly, what changes and improvements they've made. Level 2, you make a same incident report to the National Learning and Reporting System or via your head office, and relevant staff participate in a discussion about the actions, including the detail of any steps to reduce occurrence, and records are kept and the analysis and the response to clinical incidents. So again, what we want to see in pharmacies are, God forbid if something happens, if there's an incident or a near miss or whatever, you're recording them, okay? And level 3 is when you sit down as a team together and review and discuss. And it's good to see in some of the pharmacies I visited back in the day that actually the clinical governance champion used to keep a monitor of all the incidents arranged team meetings. They showed how they reviewed them, changes they made, and that is a good quality pharmacy. It's a safe pharmacy because you're putting safe patients first. There is an NHS approved particular on clinical governance as well. And don't forget, be on top of your information governance and your data toolkit also. But the key things is root cause analysis, team learning, reporting, and that is a measure of a good pharmacy. Okay. And I think Amit and I would like to think all of you guys are aspiring towards level 3. That's what we want to see to develop good quality services and good quality systems. And God forbid, if something were to go wrong, at least you're following all the steps there. At least you can show, yes, I followed it. Yes, I learned. Yes, we acted in the best interest of the patient, reported this properly. Okay, right, safeguarding. It's important that pharmacies have safeguarding in place, and now pharmacists are now working at level 3 safeguarding. So things have grown in the last few years. But if you take a step back and think about the contraception service, some of the national services that are coming through, even Pharmacy First, but also look at the local authority services. While not part of the NHS, they're still interdependencies. And if you look at emergency contraception, drug misuse, there are safeguarding practices there. So, if you're on top of this, it helps other services as well. So it's important that as a pharmacy leader, you're aware of the safeguarding contacts, who to report them to, and your staff look to you for leadership, and they know how to report incidents as well. You have the contact information for the safeguarding interventions, and the pharmacists and pharmacy technicians receive appropriate training. So make sure you're on top of your safeguarding training. And again, like the previous section, safeguarding issue happens, review it, reflect on it, and if a safeguarding issue has occurred, then learn from that incident. Sometimes you can't go past level 2 because perhaps the safeguarding issue hasn't happened, but nonetheless have the systems in place and be vigilant and remind your staff about this. And something I used to do in pharmacies, I made all pharmacies who weren't aware of this download the safeguarding app. And I think now nearly everybody should be aware of this. Amit, is that correct? Is everybody on top of this now?
Absolutely, and it was a part of PQS last year as well. Have level 3 safeguarding. Part of level 3 safeguarding is having those tools within your pharmacy setting.
Yeah, and this is a key enabler for all these services they're coming through, because again, now with independent prescribing, just hoping that things carry on, that we may see more complex services being commissioned as well. So it's important your staff have an awareness also, and if any of you get visits, and I think it's good if any of you do get visits, we do like a support session for you guys. It's important that the visiting team ask appropriate questions, not sort of off the cuff, rather sort of odd questions. You should be very much, who's your safeguarding contact? What would you do in a safeguarding issue? How do you report it as well? Okay. Now
we have Baron with his hand up.
Baron.
Hi, David. Would it be useful to circulate, I don't know, you probably are ahead of it anyway, but to circulate the latest telephone numbers for the contact teams of public health in Croydon with regards to reporting and escalating safeguarding issues?
Right. Baron, okay, what I'm going to do, okay, and Amit's going to help me to it, I will put together a guide for Croydon, okay? Now, for the rest of you outside Croydon, and Baron, don't get upset about this, we have sent to all of you the borough, local authority borough guides to all the services, have we not, Amit, for the 5 boroughs out of 6?
That's correct.
Right. Now, if you look at that, I've lovingly put together the safeguarding contacts for those boroughs. So, Baron, since you're a dear colleague I've known for a long time, I'll put together a Croydon one for Croydon contractors. Okay.
Please. Thank you, David.
In fact, I like setting myself lots of tasks, Amit, because I'm just very kind. But Amit, would it be helpful if we put on the LPC website the key contacts for safeguarding teams across Southwest London? It won't take that long.
So your guide should be on the LPC website. If they're not on there, that's an action for you.
There we go. I like giving myself actions. So all pharmacies should be at level 3, but I know this has come off the Manchester LPC website, and I'm grateful to them for sharing this. Minimum should be level 2, but really pharmacies should be at level 3. The action you take away from today is make sure your certificates are up to date, and I'll put the links for the CPP website if it isn't up to date. So you can do you can do easily a CPP module, and which you can easily get it done before submitting the CPAF by the 31st of July. And that was resonated by Greater Manchester LBC. That's exactly what they're telling their contractors to do. And also I put in the GPHC advice on safeguarding as well. Okay, so we will put that information together for you, and Baron, we will get the Croydon information out for you as well.
Yeah, thanks.
Okay.
David, sorry, one other thing with regards to DBS, something we haven't looked at maybe for a while, but getting an access point on the website where if we have a new member of staff who needs to have a DBS done, to use that as a link to.
Very good point.
Sorry. Yeah.
No, that's a very good point, and I shall write it down in my little book here, DBS and website. Okay, thank you. Thank you.
Piran,
So
just to let you know, that safeguarding app actually has contacts for almost all of England. So each borough's in London. If you look in there, they'll have one for adults, one for children.
Yeah.
I've just had a look at the Croydon one. It's got
Yeah, the Croydon one's there, but if we had something on our website, it would be just easy for somebody to just press a button and you got it there.
Yep.
Okay, right. Okay, but well spotted. And in fact, those of you who haven't done it today, first thing you can do now is, while we're going through this presentation, is get your phones out and download the safeguarding app. In fact, when you go to your pharmacies tomorrow, work with your teams who you need to know and say, right, you can download this on your phone. Because actually, when I visited pharmacies and I made team members do this, I actually helped them complete an action. I reduced their action plan by getting them to do that. And actually, they appreciated it. So there we are. Right, now this is an interesting one that's raised a lot of discussion. Promotion of healthy living. Okay, I'm just going to quickly jump to another slide to explain the concept of healthy living pharmacy. And this is something that the LPC wants to aim with our renegotiations with our local authority. That's to create this vision of these pharmacies as local centres, providing valuable care, providing public health interventions. And what did Amit say earlier when we went through some of the questions about making every contact count? It's building in value-added interventions, keeping records, providing evidence. And that's why we want to promote that concept of healthy living pharmacy. Okay, so I think, Amit, I don't know what you feel, but I think when we start to negotiate with local authorities, perhaps you should approach the local authorities to help us develop healthy living champions. What do you think?
I think that's part of it. We've already gone through a lot of this process. So a lot of this is provider responsibility. So we know we have diminished local authority teams. We need people to be on top of this. And I think still 98% of our pharmacies are. So we're in a good place. But it's a very powerful tool. The reason why we've won a lot of MEC interventions over the last 3 years is because I can go to the ICB and I can go to others saying, every pharmacy is a healthy living pharmacy. The problem is they're not resourced for the work that they do.
Yep. So we have 3 levels again, okay, and I'm really keen that all of you start hitting level 3, if not now, then over the next year, to help us on that journey as well. And the Community Pharmacy England website is geared up to provide you with all the resources there, and I've provided the links for the key information. So it's very much looking at what you do in terms of level 1, pharmacy staff engage with them, and you've got to raise their awareness of this as well. Look at the frontline staff. They may speak the language of the local community. Think about how you train up a pharmacy champion. So if you don't have one now, then think about how you start to take that forward. Look at pharmacy staff who directly engage with patients and members, because again, some people actually do that naturally as well. They could be developed up. And you have an appointed health and wellbeing leader in the pharmacy team also, who can take this forward. And then by the time we get to level 3, that's the really interesting work that can be done. So think how this question here could help you with, if you are commissioned to do local authority services, think how this could help you in the various services out there as well. Okay. And what I've done here is I've put down the links for the introduction and background to healthy living pharmacies, how to become HLP, and frequently asked questions. Okay, so it's all in there. You just have to click the links and follow that through. But right now, just declare honestly where you think you are. But once you've made your declarations and sent it in, particularly for this, then if you want to move up to the next level, do contact us just for advice and guidance so we can take you forward. And just to show you what's available on the Community Pharmacy England website, Healthy Living Ideas. Okay, so if you look at all those links, it goes to the relevant section on the Community Pharmacy England website about antibiotic resistance or alcohol. And if you look at, for example, sexual health, where we've got a pharmacy contraception service nationally, but also emergency contraception in some of our local authorities. We're smoking cessation nationally in our local authorities, substance misuse in local authorities. Oral health, again, the contracting team is a dentistry, optometry and pharmacy team at London as well. So I'm sure they would probably be able to help with that in terms of what pharmacies can do in terms of safe messages as well. But basically for you, it's a takeaway. So once you sent in your questionnaire, if you want to start thinking about developing healthy living, the key links are there, workforce development, engagement, and also the premises requirements as well. So use this as a chance once you get this form submitted to refresh and think about what you do. Okay, premises. There is a sort of approved particular on this as well. So just reflecting on my experience in terms of pharmacy visits, just make sure that your consulting room is confidential. There are no gaps, conversations can't be overheard. And sorry if it's saying the blinding obvious, you should see some of the things I've come across over the last 10, 12 years in some of the pharmacies. Think about how the patient perception, particularly try to keep it as neat as possible. Making sure that that space is provided for difficult or sensitive issues, and that pharmacy premises are clearly identified and a prominent health promotion zone. Level 3, this is where it gets more interesting. It's around the environmental impact, reducing a negative impact, so recycling paper waste, recycling plastic, which may be some support if you work for corporates or multiples. I'm sure that advice is provided to you anyway, but I'm sure the NPA has got some guidance that you can actually follow as well. So again, your consulting room is very important. Thinking about 10, 15 years ago, most pharmacies did not have a consulting room, and we've taken a major step in that space of time. So I'm sure our public appreciates our consulting rooms. But again, just think about the space, how it's presented. It's a sensitive area for your patient, and this shows the way that community pharmacy is now moving forward. Okay, and I provided the links to the approved particulars for premises as well on this page. So this is going to be important. And of course, a consulting room is a key requirement for some of the advanced services as well, and probably some of the local authority services. Staffing. Each pharmacy is responsible for their own HR and staffing. Now, of course, if you're a corporate or multiple, this is already covered in your sort of head office. So for those of you working for the corporates and multiples, again, you just signpost to corporate arrangements. You may want to show some of your induction programs and HR policies. More than likely, it's your group manager or head office that actually deals with this, which is a fair answer. For those of you probably more independents, whatever, the NPA just provides support information to that. The important thing is that anybody working for you has a PDP, a developmental plan, a training record, and their arrangements for permanent and fixed members of staff as well. There's also a process for ensuring that staff have smart cards when they join. So if you're not clear about that, do email us at the LPC so we can send information to you. And effectively, you need to make sure that if you're going to deliver all these services and all the new services coming in, it's important that it's reflected in job descriptions, it's reflected in roles, and more importantly, as a part of a joined up team. And we talk about the pharmacist, the technician, the registered technician, the dispenser, the frontline member of staff, that the roles are stratified to support you with all the different services. So with this one as well, what probably if you were to get a visit, the inspecting team may want to see to show us some of the training plans you do, show us what policies you have around disciplinary matters, what accreditation do you have for the various services you provide as well. So, your team is meant to back you up and support you. And so at the same time, you must make sure that you're backing and supporting them by the right development and support. Okay. And then opening hours. This has been a challenging issue about what you believe your opening hours are versus what the London team have. They have what is called a pharmaceutical list for every single pharmacy in London. or it's actually a national requirement, which shows your core and supplementary opening hours. So again, not meaning to insult people's intelligence, but if there's any doubt, just contact the London team to get your specific core and supplementary hours. Okay, so you need to be aware of what it's set as. And then if you need to change, you put a submission through the market entry team at NHS England. You can't just change it just like that. How you use DOS and on level 2 and update your profiles. There's also maintaining contracted opening hours and notifying emergency closures. So in your operating procedures, who do you need to contact? Who do you need to inform? In your business continuity plan, there's a call list of people that you need to contact, particularly if there's a temporary closure. There are procedures for temporary closures, which you have to go through the London team as well. But level 3, and I think most of you will be at level 3, is of course you would do this instinctively. This is the time now to think about all your other services you provide that are commissioned, not just through the NHS England with your core services, but also the ICS may have commissioned some services in the past. The local authorities definitely have. So if there's a change in opening hours, you need to inform those commissioners as well. Okay, and also you do this anyway. In terms of the second question for level 3, we send you, or the London team sends you, all the rotas and bank holiday information, and you all display it. So there's an audit from London region sending out all the rotas to the pharmacies and to the LPCs and the ICS, and then you normally print off and display. So I should think most of you should be able to take at least the second question of level 3. But today, and when you go back, if there's any change in your pharmacies, think about your other commissioners you provide services for, have a contact list and let them know. Because normally they come back to the LPC or the ICS to say, what are the opening hours of these pharmacies? We're not too sure ourselves. So think about the impact. If you make a change in your pharmacy, think about who's affected, not just the patients, but also the people who commission services. Okay. And that's just a bit more information about temporary closures. So I'll start summing up. The top tips are, this is about providing assurance, and we want to have high quality services. Okay, so diarize this. So put in your diary now when the CPAP processes timelines take place, so you're ready for this. Start from the full questionnaire and then read the screening question. I think the best thing now is you just complete the screening questionnaire and get it sent. But definitely look at the full questionnaire, just in case, even if you don't get, sort of selected to fill it in or whatever, just be aware of the full breadth and complexity of it, okay? Because then it'll make you more aware of what's going on. When you look at CPAF, when you look at either the screening questionnaire or the full questionnaire, think about how your pharmacy team can help you, okay? And we talked about, I just came out about job roles and job descriptions. Think about how they can be built into objectives and job roles. So it's not just you doing everything as a pharmacist, it's also the rest of the staff. I've given you the links for the NHS approved particulars, and it's worth reading it up to on top of all those areas of your clinical governance. We've talked about recording advice and intervention. It covers several aspects of your contractual framework. They overlap. It's a core ability. And Amit's also mentioned about making every contact count, interventions, about giving a full, rich, referral and advice to patients, but documenting it so we have the evidence to show commissioners. Identify team champions, so clinical governance champion, healthy living champion, or health and wellbeing champion in your pharmacies. Okay, clinical governance does not have to be a pharmacist; it can be a technician, for instance. Okay. Save your screening questionnaire response once it's sent in. Keep a copy of it, and whatever levels you have, think about how you get to the next level up over the next 12 months, and please contact us for advice as to how to do that. We want a network of good, high quality pharmacies so it gives us the sort of evidence to commission more services. And my feedback to you is everybody does this on the last day, and of course MYS gets overloaded and it doesn't work. And we get all the complaints coming in that it's not going through. Try and submit with 2 days to spare. So at least you get it done and out of the way. So really from this presentation, you should be able to now hit the ground running and get it done really by the beginning of next week at the very latest. Okay, give yourself some time. And if you pick up gaps through the screening or even the full CPAF further down the line, don't wait for a visit, address them now. You're more than welcome to email me at the LPC for advice how to sort of complete things, but don't wait. just fix it there and then get that done. And please don't sort of, we don't, the LPC doesn't want to guess, we want to help you and support you. So just reach out to us. We've had a few good questions coming in over the last few weeks since we've announced this presentation. So effectively, we want to make sure you are fully supported. So I shall now stop sharing. And there's a few more people. That's good. And then hear from all of you. If anybody has done the process or would like to feedback their experiences, I'd very much like to hear from people. Maybe there's some people there I used to visit back in the day who'd like to now tell me what they thought of it.
Thanks, David. And just to add, there is a Community Pharmacy England briefing. There was a previous webinar held, so I've shared the link in the chat for everyone who wants access to the Community Pharmacy England briefing on CPAF as well on their page.
Going back to that healthy living question, in the past we used to have training for healthy living champions in Southwest London. How do we get new champions trained up now? David, any ideas?
Well, I mean, that's the thing. It's very much, you look at the Community Pharmacy England website and the links provided. It's very much telling you this is how you go about sort of identifying somebody, one of your team in your pharmacy, to take that forward. It could be a frontline member of staff. It could be sort of your technician, whatever. It could be one of your pharmacy team people as well. It provides you the training links, but also gives you examples of the different areas you can actually a champion in. I mean, you may have a champion, for instance, for sexual health. You may have a champion for stop smoking. Those are just some of the examples given. You just pick the ones that's most relevant to you as well.
And the details for the CPP training are in the briefing for CPAF that I put in the chat. So really easy to access through there. I've also just added in the CP page on healthy living pharmacies, which is quite out of date. Maybe Baron, you could just feedback an update into that page. But there are links for CPP training for healthy living pharmacies in the CPAF briefing from CPE. Baron.
Amit, have we got any source of funding that we can tap into to pay for some of the courses? Because some of our champions have either moved on or changed roles. So we want to get more trained, as Umesh said. But obviously, we can subsidize the cost of them leaving the pharmacy in the morning or something. But it was a cost of the actual healthy living champions course. In the past, we had funding where we managed to tap into various sort of industry suppliers.
Yeah, I think that's a really good question, and we should look into it. My understanding was the CPP training is now online and free. Is it still face-to-face? Because if it is, then we can definitely look into that.
Why don't you let us, Baron, follow that up with CPP just to see what resources are available. Is it online or is it face-to-face? And Umesh, that answers your question as well. And what we can do also, Umesh, is look at actually CPP deal with a lot of pharmacies. They may have examples of best practice as to how some other pharmacies have done this. So I think I'll reach out to Michelle and the team in London just to see how that's actually being done, if that's okay with you.
Yeah.
Stunned silence. Gosh. It's only once a year, guys.
David, one other thing, we mentioned about signposting and sort of providing information for everything we do. I mean, currently, if you look at the work that community pharmacy is now being commissioned to provide in terms of pharmacy first, contraception, hypertension, and with quite a few new things coming through in the pipeline as well. We are, in a way, a complete, a provider of all health-related issues. So So basically, what I'm trying to say is that we need to have a system where we can advertise what we're doing and at the same token direct patients to our services.
Well, this is something that I know Amit and I and Dean are discussing in terms of how we get Pharmacy First rebooted in terms of increased referrals and work with general practice. But of course, this is just discussion, everyone. we still have 6 local authorities. They deal with communities and their local authorities, and I think there's a piece of work we need to do back with the local authorities to explain these are the services you can get free of charge from a community pharmacist. Help us work with some of the communities. Now, I know for any of you in Merton, they've got the family hubs, and I've been quite keen to explain and go to a few meetings to explain these are the services that are provided. There's also, each borough has like a carers association. Again, that's another group where we could say this is the kind of services you can get from your community pharmacist as well. So I think it's how we work with our local authorities to socialise the services that are available. And I think one or two boroughs have said, if you can send us an updated list of pharmacies who are providing these services, then we'd like to look at referrals. So I think, again, let's work smart. When we start having proper discussions with all our local authorities, that is something we probably need to raise. Local authorities aren't paying for these NHS services, but their residents benefit from it. So I think there's something about how they can improve referrals into community pharmacies. And I think your friends in Croydon definitely have got something to make up for over the last few years. I think we could start with Croydon. That's a bit of an in-joke, guys. For those of you not in Croydon, that's an in-joke between me and Beren.
That signposting goes 2 ways, doesn't it? And I think Beren is, we're really glad to have you here as a CP representative on this, because signposting into community pharmacy, I absolutely agree with you, 100% important. We need proper referrals into pharmacy so that we can maximize on the contract. And it's something that I reiterate in every meeting I'm in. I was with the HSJ today at a round table, and I was talking about exactly that. And then there's Essential Service 5 and signposting out of community pharmacy, which shouldn't really be an essential service because it undermines what we're trying to do with MEC interventions, etc. There are no limits to it. And, I think part of feedback that we're really keen to give to CP, not just as an LPC, but as Pharmacy London as well. And I should mention Pharmacy London because they do a lot of work behind this. Is that with contract negotiation, signposting should be taken out of the contract.
Exactly, because it's already there. In fact, they expect us to signpost, but conversely, they're not signposting back to us. And especially with the number of gateway criteria that we need to achieve in the next couple of months, it's going to start racking up 20 to 30. It's going to be a hard push to get everybody through that gateway, and this is when we really need the signposting. And at CPE, we actually designed it in such a way that the health authority is going to be racking up the referral processes, and they haven't delivered. So ICSs, ICBs need to be hammered on this.
Yeah.
Well, I think that's a clear conversations we need to have with all the local authorities in one room about how we can work with them to start referral from their communities to pharmacy, how they can work with the LPC again, and we can pick up any referral issues as well. But that's one area of pathway that we could work on right now.
Well, it's how do we hold GP practices to account? That's where the referrals need to come from. Public health directors have statutory responsibility to hold the ICB to account. So, David, you're right. Our public health directors really need to be pushing this home.
Yep, absolutely. It's a public health issue.
Do we have any more comments or questions?
Can I just ask for feedback? Are you all feeling confident about filling these screening questions? They've been in place for the last few years, so it's not too different over the last few years. Are you all feeling confident that you can get this done by next week? Well, don't jump at once. Well, love knows, that's good. How about Medimpo, the only person who's not shy?
And I've always put a thumb up as well.
Afwa. Oh, that's good. Are you feeling generally? You feeling okay about filling this in? Yeah. Okay. I think the learning for the LPC is maybe we should do this a few weeks earlier, at the start of July, so we just can just time this. It's just that this was the timing of our next evening peer meeting, so we just put CPAF in. But maybe next year, reflective practice, we do this a little bit earlier by a few weeks.
Yeah, absolutely.
Yes.
Just to reiterate, we have contact methods. David and I put our mobile phone number at the bottom of all of our emails as well. Our lines are always open to everyone.
Yeah.
Vanna.
Sorry, I was just going to say, yes, I think you're right, David. That would definitely help because a lot of people are going off on holidays and it's just trying to fit everything in a timely manner so that you're able to do it correctly without having a whole lot of action points to complete afterwards.
Absolutely. We just want to reduce the working as well. So just we are contactable, and just that's all we're here to do. One less thing to worry about.
And just to give everybody context of what CPE has done with this, if you look at the questions, there are quite a few questions that have been redacted. And that was because of a pushback at the committee to say that there is enough workload and we just can't deliver. And if you look at the stuff that has come through in terms of questions, it's pretty reasonable to do because that's what we would expect most pharmacies to have in place. So we fought back and streamlined it so quite a lot to make sure that most pharmacies can accommodate with it.
Fantastic. David, I'll hand over to you to close.
Right, so again, these evening sessions were set up for us to help you. I've got blurry. What's wrong? There you go. I've been up too late. So I want to thank you all for those who attended. Can I ask a favour of all pharmacy colleagues here? If you see one of your colleagues who's not here and they are struggling, reach out to them, give them our details so we can help them. We want everybody to do this as well. So put the words around. We are recording this, so we'll share the recording. We will share the presentation. I think I'll work with Hina and Amit to make sure it's actually, the link is on the LPC website because this is actually quite a big presentation with all the pictures and graphics I put in as well. You have the South London FAQ for waste, so you should be able to deal with any waste queries. We sent out the in Word document the guidance on taking interventions and recording interventions, so you've already got that as well, but we resent that also. And as Amit's mentioned, the first thing we sent out was the CPE, the Community Pharmacy England briefing on CPAF as well. So we really are trying to help you as best as possible. So with that, thank you very much, everyone. And thank you very much for attending as well. And it'll be up to Amit and Baron, the LPC, to decide if we can give you a break in August and then resume in September. Absolutely. But again, wish you all a lovely evening. You've all worked hard and thank you for turning up. Those who turn up make the decisions. And Amit, I'll stay on with Hina and Baron afterwards.
Thanks a lot.
Thank you very much for attending. It's really appreciated.
Thank you so much.
Thank you. Thank you, Lubna.
Cheers. Thanks, David and the team.
That's all right, Gamesh. Good to see you. Thanks, Kishan. Yogesh, is that Yogesh formerly from Ashburton? Perhaps it's a different Yogesh. How did that go? Oh, are you still recording?
Let me stop recording.